My name is Philippe Gros. I am a researcher in the Department of Biochemistry at McGill University. I'm a geneticist by training. I'm very interested in genomic medicine and the novel RNA therapies associated with it. And as such, I'm excited to be part of D2R as its chief scientific officer. DNA to RNA, or D2R, is a McGill research initiative looking at RNA-based treatments for rare and infectious disease and for cancer. It brings together researchers, communities, partners, patient groups to push discovery forward. It works with biotech, pharma, government agencies to bring ideas into solutions. A key goal is to support Indigenous-led research in ways that are culturally safe, respectful, and community-driven. Everybody's genetic code is slightly different and unique, and those small differences define us as individuals, but also sometimes code for particular diseases. The characterization of these changes by novel genetic and genomic techniques defines the science of genomic medicine. Genomic medicine can be used to identify those variants and produce a more precise treatment or prevention for that disease. RNA-based therapies can quickly be adapted from genomic medicine-based information to develop those treatments.
Hi, my name is Loretta Montour. I am from the Mohawk Nation of Ganawage across the river from McGill University. I was invited by D2R in 2025 to provide my experience working with Indigenous peoples on genomic projects. Indigenous leadership is built in at every level of the D2R program, starting from the International External Advisory Board to the Working Group on Indigenous Health. D2R has an Associate Director for Indigenous Health, as well as liaison officers working in the Indigenous health field. Projects are co-created with communities, and the research focuses on cultural safety, respect, and building trust over time.
My name is Loretta Loon. I'm the Associate Director of Indigenous Health Research here at McGill University, working within D2R. I'm originally from the James Bay area. I'm a band member of Fort Albany First Nation and also a Clan Council rep of Mo Quebec Council of the Cree Nation based in Moose Factory. D2R is starting to build relationships with Indigenous organizations across Canada, such as the First Nations of Quebec and Labrador Health and Social Service Commission, and Daha Digon Sassai Quebec Network Environment for Indigenous Health Research. Early conversations and joint projects are underway. D2R will soon launch a dedicated funding program for Indigenous health research.
There are many benefits, we think, of working with D2R. First, communities helps shape the research so it reflects their needs. D2R supports Indigenous led projects building on local skill and resources. D2R can bring treatments and health outcomes to those communities in the long run. It ensures community have a say in new medicines that may be provided, and also it creates partnerships that last and support the next generation of individuals.